Josh Sharfstein and Stephanie Desmond, thank you so much for joining me in the studio. We are actually together this is our third end of the year sort of podcast recap. We've done these over Zoom so far, but now we're actually in the studio, which is amazing. And we're going to talk about that. But first, I want to talk a little bit about the fact that this podcast is not all that we do. And in fact, Stephanie, you're just returning from Thailand. Tell us a little bit about that.
So my day job is the communications director at the Johns Hopkins Center for Communication Programs. And I was just representing the organization at the International Conference on Family Planning in Thailand. And among the other things I do, besides this podcast, as I also, on the side, I'm writing a book with Dr. Arturo Casadevall, who's been one of our guests in the past. And it's going to be about the rise in fungal disease.
Which we've covered on the podcast.
Which we have covered, and there's a lot more to say.
Oh, good. That's very exciting. And then you're actually leaving in 2 days to go somewhere else.
Yes. So the Johns Hopkins Center for Communication Program is running the 2022 International Social and Behavior Change Communications Summit in Marrakesh, Morocco, where I will be working with my colleagues to lead the communications efforts both for the center and for the whole conference itself.
But we still have podcasts with you that will be airing.
Yes, yes.
And Josh, I hear you're teaching a class or two right now?
I am teaching a class now. Yep, I'm on the faculty in the Department of Health Policy and Management. And I have a class called The Media and the Message, What Public Health Needs to Know About the News. I teach it with Joanne Kennan, who is a journalist and the journalist in residence at the School of Public Health. And we cover the changes in the media going on now, the decline in local media, for example, but the rise in nonprofit media and other kinds of innovations. We also talk about misinformation, the challenge, and some potential solutions.
Is there a bumper sticker slogan for what public health needs to know about the media?
I would say that public health needs to pay attention to the changes in the media, and that doing the kind of thing that I used to do when I was the health commissioner of Baltimore, like putting out a press release and talking to a couple reporters, like perhaps Stephanie when she was at the Baltimore Sun, I used to talk to her, that won't cut it anymore. The world is just so completely different. There's so much misinformation out there, but there's also so many different channels of information. You really need to be thinking 2 steps ahead.
That is good to know. So I feel like we've taken your class at this point with this podcast. That's what we're trying to do with this podcast. So hopefully, maybe we're one of your examples in your classes. You know?
Well, I think that getting the podcast done and getting all these downloads and back and forth with our listeners is a way to improve the information environment.
Well, speaking of which, our listenership has gone up significantly. So let's start with you, Josh. Do people ever randomly come up to you and recognize you from the podcast?
I would say randomly, no. Like if I'm at the supermarket and I say something like, I'll take a plastic bag. I left my bag at home, or a paper bag or whatever it is. Nobody goes, wait a second, I know that voice. That never happens, not once. I'm waiting for it to happen, kind of. But if I'm like at if I'm giving a talk somewhere and now we're in person a little bit more, and there are maybe a couple people waiting to talk to me afterwards, I can sort of tell by the kind of expectant look on somebody's face that maybe they're going to say something about the podcast. And then I get a little nervous and they go, I just want you to know I've been listening to the podcast. And I always say one thing. We appreciate you. That's what I say. Yeah, I appreciate the listeners, and it's fun to meet people who've listened to the podcast. And I'll just say that we did a podcast this year with Lyriam Baird, the mayor of Lincoln, Nebraska. And she called me excited afterwards because I think like random people in Lincoln, Nebraska were coming up to her. Now they knew her, but they were also listening to the podcast. And so like someone at the place where she gets her car fixed or some other place, they were all saying, we heard you on the podcast. So that makes me feel better even than when people tell me they've heard me.
We have a fan base apparently in Lincoln, Nebraska. Who knew? Stephanie, have you been randomly recognized?
Again, not quite random, but I was one time going for a walk in my neighborhood and I crossed paths with a friend and she's like, I'm listening to you right now. So that was, I was like, oh, okay. Well, then I don't want to interrupt you.
I've actually had the opposite experience. I am currently 36 weeks pregnant, and one of my care providers that I saw, I realized she had been on the podcast before. And I said, "You've been on the podcast that I produce." So mine went the other way. So at the end of last year, when we were gathering on Zoom to kind of talk about the year in review, we talked about what we might explore this year in terms of COVID. And one of the big things that we talked about was the strategy and the response. So I'm going to start with you, Stephanie. What has surprised you about this year? What are your thoughts on kind of where we were a year ago versus where we are now?
Well, I think, a year ago, we did not have pediatric vaccines. And a year ago, we didn't have Paxlovid and other treatments. So in terms of that, we have definitely improved how we take care of people and how fewer people are dying. But at the same time, I guess my concern is that, for example, we've had this country's had to fight for every dollar to continue to vaccinate people and to continue to do research into treatments. And to me, it's feeling like a lot of people think that this is over. And I know that only 350 people a day are dying, but that's a lot of people for a disease that we didn't have 3 years ago.
Josh?
I remember at the beginning of the year, we did a podcast on, rethinking the COVID strategy. And I kind of expected there would be a big discussion on how to rethink the COVID strategy. And in fact, we had, I think, different people. Celine Gounder was on, Emily Gurley, Monica Gandhi. We had different people talking about different flavors of what we might do differently. And I thought that was a really important discussion to have. But to Stephanie's point, it kind of faded as people just sort of moved past COVID. We didn't really have the discussion of like, well, what's the strategy for it? I mean, I think you could have a strategy even if the strategy doesn't include too many intrusive things, but you still have a strategy. And I think we're now maybe paying the price for that lack of strategy as hospitals are filling up with patients with multiple respiratory infections. And I'm thinking particularly of kids. I'm a pediatrician. And what I hear from pediatric colleagues is that this is just an incredibly difficult time. And I think if we had had a little bit more of a approach to, managing respiratory disease, including COVID, maybe we wouldn't be in such a serious condition. And I also would certainly echo Stephanie's point that, we have to be prepared for this to get worse. And we shouldn't, how many times in this pandemic the cases go down? Like from the very beginning, I remember the Vice President, Mike Pence, was saying like, it'll be gone by Labor Day, or it'll be gone by Memorial Day, I think he said initially. It's like every single time we've tried to convince ourselves that it's going away, it's better to be prepared.
One of the things that we've talked about on the podcast is the fact that COVID has not yet hit that seasonality that we had maybe expected to see at this point. And another thing we talked about last year, at the beginning of last year, was this concept of kind of grouping all the respiratory viruses together when we consider like the burden on hospitals and things like that. So it seems like we are moving in that direction.
Well, Andy Pecos, who is one of our regular guests on the podcast and a great virologist here at the school, he pointed, I think, to the fact that we haven't seen that seasonality as a reason to believe things are still in flux. It really hasn't settled down. And for him, that would be a good thing if it sort of joins the other cold viruses. But until we see that, we have to be on our toes.
For sure. So as we've, in these lulls sort of, where we still have multiple hundreds of people dying every day from COVID, we have started to cover other topics on this podcast, including things about the environment and reproductive health. I want to talk about some of the notable guests that we had this year. So Stephanie, what are some standout guests that you interviewed?
I think what comes to mind first is Megan O'Rourke. She is an accomplished science writer and author of a new book this year called Invisible Kingdom. And it was actually about her autoimmune diseases that she turns out took a long time to be diagnosed. And they were very reminiscent sort of this whole movement of long COVID. And so she talked a lot about her experience and the challenge of being, having this disease that no one can tell you what it is. And it very much feels like a precursor to a lot of people who are going to be feeling this way with long COVID in the future.
And we will continue to cover that as well into the next couple of years, I'm sure. Josh?
I think this has been a year of expanding our non-COVID podcast, but of course we've had non-COVID podcasts for quite a while. There's a really interesting series about the Jackson, Mississippi water crisis, including some voices from within Jackson. We've had a number of podcasts about reproductive health in the wake of the Dobbs decision that I think have just incredible implications for health in this country. And it's got to be something we should stay on top of. Uvalde happened this year, and there have been a number of podcasts about guns and different kinds of violence that I think are really important. I'll mention two, though, that are a little different than that. One that I really like was a podcast that I did with Alexander White and Rachel Thornton about a book that W.E.B. Du Bois wrote at the turn of the last century. And it was about essentially inequity in health. And it sounds like it could be written today. It was about how you just can't blame people for being sick or a population or a community for being in worse health than others. You have to look at the conditions that put them there. And in particular, he was talking about the Black community of Philadelphia. And it was both incredibly illuminating to hear these two scholars talk about that, but also really heartbreaking to hear that, that work never really caught on for all kinds of reasons that were talked about in the podcast, and we can all imagine. The mainstream of public health didn't embrace that for many, many years. And only now is that really coming into focus, that we have to think about health more broadly than just people's individual behavior. I thought that was a really good podcast, and they're really making the case, which I think is incredibly important for public health students, medical students, and others to learn that as part of their core teaching rather than as sort of like an optional elective or something like that. I'll also just mention there are a lot of podcasts that I like. And I apologize in advance to my mom that I'm not going to mention the one with my mom as one of my favorite podcasts. I'm just glad that I made it through that podcast. But the podcast with Keith O'Brien about Paradise Falls, his book about Love Canal, I just thought the book was really interesting. The podcast was interesting. What a crazy story. And really it helps you appreciate the rise of activism, the changing way the media works. They literally took federal officials hostage in order to get attention to an environmental catastrophe in their own backyard. It's just, what an incredible story.
I have to say that I myself was starstruck when I got to interview Beth Macy, who's the author of Dopesick. And this was right around when the Hulu miniseries came out, which got a lot of awards. But, covering the opioid crisis is something that we will continue to do on this podcast. And we've had a lot of different angles in harm reduction. And so that was the one for me. Let's talk a little bit about politicians. I want to talk about Josh's experience interviewing politicians.
I don't think we've done too many politicians. And let me just say, I think I'm perfectly comfortable with that. I think our goal in this podcast has been information, not so much the razzle-dazzle of, a particular guest's name. One of the more interesting reflections this year is that we had a politician on the podcast before he really officially became a politician, which is the new governor of Maryland. Wes Moore was on a couple of years ago, actually, talking about his book about Baltimore. It was a great interview, and he is a very thoughtful person. I'm really excited to see what he does as governor.
Yeah, that is a great episode. If you go back through our catalog, that was in September of 2020. He was talking about Freddie Gray, and that's a great interview. You brought up previously your mom as someone who frequently gives you feedback. So I want to ask you both about the feedback that you've gotten that maybe you've least appreciated or most appreciated. Let's start with you, Stephanie.
Well, my mother doesn't listen to the podcast, and so I cannot tell you how she feels about it this day and age. I will say that we heard from a listener who said, I don't think this person has a medical degree, referring to me as the interviewer. And I will just, for the record, everybody, I do not have a medical degree, but my goal here is to talk to those who do or who don't and get them to talk about these really important issues in plain language that we can all understand. Because I think that there's a lot of people in this institution and in medical centers around the country and the world who have a lot of information but don't know how to share it and share it in a way that's actionable for that people can understand and change their behavior based upon it. And so I think that actually should be, can we get arranged to have that be a class in medical school? Because I think that would be great. Sort of explaining this to your mother would be the class, I think.
I think you could teach that.
Maybe.
As a former journalist.
As a former journalist and a current mother, I could.
There you go. Josh?
My mother is a physician, so that would be a slightly different class for her. That's why I'm always worried when she calls me, because she's usually correcting me on different things that come up. I think for me, the biggest challenge, we get criticized on both ends of the spectrum. We're too controversial, we're not controversial enough. Too controversial because people perceive that when we talk about the public health implications of, for example, ending the right to abortion in this country, that is perceived as political. We are covering the health impact generally, and we want to inform people about what this actually means. And I think some of the podcasts that we've done have really explored that. Not controversial enough, we get criticized because people say, well, how come you haven't had this person on the podcast? And this person, is really seeking controversy, whoever this person happens to be at the moment, and maybe, on TV spouting all kinds of extreme statements or pointing fingers at people. And, we are not trying to do that either. I think the messages that I like the most from readers where they say that the podcast is a place that they come to learn, for things to be explained. They're not expecting the same thing every episode. They understand their different points of view, but we try to do that with respect. We're not courting controversy. We're not avoiding it. We're trying to, take a fair look at key issues for public health.
This year, we ran our first listener survey, and we got some really great feedback from our listeners who we appreciate. That should be our new tagline. And a lot of people just thanked us for this work that we've been doing. And I do want to acknowledge again that all of us are doing this on top of our full-time jobs. This started as like a COVID project that we had no idea it would still be going 3 years later. And then some of you have left us some really beautiful reviews on Apple Podcasts. Someone the other day said that our podcast was like getting a warm hug from someone in the know. So I really appreciated that feedback. So we've looked back, at the last year or two. Let's shift a little bit and look forward. Stephanie, what topics do you think we'll be digging more into in 2023?
Well, I still can't help but put COVID on the front burner, because it still remains a public health issue. And I'd like to see us talk more about what we're learning about long COVID, if we're coming up with greater understanding of what happens in the long term, because it's possible that we could find that there are side effects years and years down the road. I'd also like to talk more about the world and COVID and vaccines and how the inequity continues to grow, and how we have these wonderful vaccines that nobody in the U.S. really wants, but we have, and we've got stocks of them. And then we haven't given a first dose of a COVID vaccine to a lot of people in Africa and Asia. And so I would like to talk more about what is getting in the way.
Josh?
Well, I think that as long as we can cap the number of fungus-related episodes at a reasonable number, then we'll have space for some of these other topics. I certainly think, actually, some of the podcasts we're doing, talking to people around the world, are quite interesting, and hopefully we can do more of them, particularly voices from people experiencing public health challenges in different parts of the world, I think are interesting. And since our school has such a broad international reach, we can find ways to do that. The topics that we're covering, we need to keep covering. and some of those we've talked about already today. Let me mention two others. One is, as we're switching gears on COVID, I think there's a really important question of what we've learned, not the three of us, not even our listeners, but what our country and the world has learned. Are things actually going to get better? Are people going to just forget and put it in the rearview mirror and then just run into the problem again? That could come up during the current session of Congress we're in before the members of Congress change. It will certainly come up in 2023. And it has huge implications for public health at every level. There were more resources given for COVID, but are we just in the boom phase of a boom-bust cycle and we're just going to see everything empty out again? I think is really important. Another topic to mention is the courts, not just individual decisions. We've covered individual decisions, but something is going on with the Supreme Court, I think, with respect to public health that we need to be talking about, because I think people who are interested in health don't appreciate it. It wasn't just the Dobbs decision. It wasn't just the decision that struck down the New York state law related to guns. It wasn't just the decision that struck down OSHA's rule on vaccination. But it's sort of the whole theme. And in fact, at times, the courts have said that evidence doesn't really matter to them anymore. What matters is history. And so they're, digging around for like very old laws and what was around at the time of the founding of the country, rather than, what actually works or not. And that is a break from what the court has done before. So I think that, we have to look out beyond just the confines of public health to understand what's going to be really important for the health of the country.
One big thing that we will most likely continue to cover is the Inflation Reduction Act. And there is a huge part of that is dedicated to climate change. And so starting in January, on Mondays, we're going to be running a series on what's being done to advocate for climate change. This series is supposed to be hopeful and uplifting. It's not supposed to be a gloom and doom, yet another climate, trying to make people aware of the problem. So I'm really looking forward to that. Those are going to be some great episodes. Anything else you all want to kind of wrap up the year with here? We're all still talking about COVID, still talking about these other issues. We didn't touch on monkeypox, which was the big sort of, I guess, public health surprise this year. Anything else?
Well, I expect that we will be surprised by things in 2023. We did cover the war in Ukraine.
Yes.
And I'm sure there'll be a lot more to say about that. They're still attacking hospitals, the latest that I saw. We have so much out there. I know that I will say this, though. It's been, in a way, very helpful to my personal coping with all the changes in the world, to be able to talk to experts, but also to be able to work with you guys and the whole team, frankly, in putting together a podcast that really tries to be fair and informational and explanatory and maybe not always hopeful and uplifting. That might be too high a bar, but at least relevant.
And as much as people said during lockdowns, for example, that how much they appreciated hearing the latest and best information about COVID, I think that, throughout this whole time when life has been in an upheaval because of COVID, I personally have been really gratified to be able to sort of help other people make sense of what's going on in their lives.
This is definitely my favorite part of my other full-time job, for sure. And I do want to once again acknowledge that we are actually together in the studio, which we did not. Every year that we've recorded this, we've been like, maybe next year. We're finally here. And I want to give a big thank you to our multimedia team for making this happen. And a big thank you to all of our interns and our staff and everybody that makes this podcast, brings this podcast to you 3 times a week, plus some bonus episodes here and there. We're all fully committed to keeping it going. So thank you both for joining me today in the studio, and Happy New Year, right?
Thanks, Lindsay. And I hope you'll be listening when you're at home on maternity leave.
I will continue to listen, and I'll be back. Don't worry. Thanks.
Thank you.
Okay, that's a wrap.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinal, Spencer Greer, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.